Hello and welcome to another edition of Ask Me Anything Live. We're here in Central Park. No, just kidding. We're here at Stanford Hospital in the beautiful garden area. And we have with us today Sharon Chinthrajah, and we're going to talk about what we're all suffering these days, and that is allergies. You know, the coughing, the sneezing, the runny nose. We've heard all about it. It seems like welcome, by the way.
Thank you, Lisa.
So it seems like the allergy season has started earlier, and in some aspects, for some people, it seems worse than ever. What's your take on that?
Yeah, this is a great question. Every year I'm asked, is the allergy season starting earlier? And it seems like the answer is yes. And so, you know, I think California, we're subject to drought and then heavy rains, and that leads to super blooms, essentially. And so while we hope for snow in the Sierras for good skiing, the rain here really helps the flowers and the trees and the grass all grow, and we're really impacted by the environmental pollens that are in the air.
Well, we're out in the elements today. I mean, I can just feel the pollen wafting through the air. Does climate change play a part in the degree of severity of allergies?
This is a great question. We know that climate change can lengthen the seasons for allergies. So data out of Stanford really looked across the pollen reporting over time, and we saw that, you know, for instance, tree pollen season, grass pollen season, weed season was lengthening in time on either end. So the start of the allergy season and the end of the allergy season. We think that for some plants, there can be more pollen that's released into the air. Whether that impacts patients' severity of symptoms is really hard to track, because I think that's really a build of each individual's immune system over time and how much exposure they've had.
Well, let's go to Basics 101. What is an allergy?
So an allergy is when your body mistakes things in the environment, in the air, as toxic, as dangerous, and really mounts a reaction to rid your body of these toxic products. And that really is because in older times, we were trying to fight off worms, parasites that may be exposed through our skin, or eating foods that are contaminated. And we create antibodies to really recognize proteins in these things, foods, pollens, animal dander, and release chemicals to, you know, really rid ourselves of these products from our system. So that leads to histamine release, and that'll be important because we have antihistamines to treat allergies, right? And leads to allergic symptoms, right? Like red eyes that are very teary, right? And that's our body's way of trying to wash that pollen out of our eyes. Or mucus from our nose, or trying to
sneezing.
The sneezing. It's really, we're trying to expel all of these toxic substances from our body.
So in terms of allergies, they begin at a very young age in kids, and also as you grow older as adults. Can you ever grow out of an allergy?
Yeah, this is a really great question. So you don't necessarily have to be a lifetime allergy sufferer. Some people will outgrow allergies, but some will not. And sometimes, if we're talking about seasonal allergies, it may be that you change location. So you're exposed to different blooms, different pollens. And you might have different influences in your life that skew you away from allergy. So I think of allergy as a product of our environment, and a little bit of the environment's impact on our genes. And it's that combination that maybe tells us that allergies will persist or stop.
I don't know, as when I was younger, decades ago, just kidding, I didn't suffer as much from allergies, but I seemed to be more prone to the allergy later in life. Is that true? And why is that you develop these allergies later in life with the watery eyes, the sneezing? I mean, it just continues.
Yes. So not everybody develops an allergy later in life, but why will an adult all of a sudden develop an allergy? And I think this is a question many of us are trying to understand so that we can not be one of those people.
Yeah.
I think it's a combination of factors. One is this hygiene hypothesis, right? Where we're living in cleaner environments. We're using a lot of hand sanitizer. We're trying to protect ourselves from dirt, and using a lot of soaps. And those things, those behaviors are twofold. One is getting rid of maybe helpful bacteria on our skin and in our gut. And two is breaking down that first line of defense in our system. So the skin barrier, either in our skin, lining our respiratory tract, our airways, right, or our gut. And what that does is makes that barrier leaky. And so the environment is coming in. And if you're already predisposed to allergies, maybe because you're not eating the perfect diet, you don't have a lot of fruits or vegetables, you're eating more processed foods or fast foods because life is busy, right? So it's a combination of those factors then that might skew us more towards allergy and away from tolerance.
So we're sort of breaking down our first line of defense against the allergies. Can allergies resolve on their own? Can you ever grow out of allergies?
Yes. So you can grow out of seasonal allergies.
When's that day coming?
Well, it's hard to predict, right? And this is the thing, is that each individual is so different. We don't know the things, the 1, 2, 3, 4 things that led to the development of allergies in that particular person, and how to dial back the clock. And this is true not only for seasonal allergies, but also for pet allergies, also for food allergies. And so what I try and tell my patients is really try to restore the things that you can restore and see if we can change that clock back. So
for instance, restoring what?
Yeah.
Because a lot of people are listening and watching right now. So we're looking for some fast relief here.
Yes. Well, some of the things are restore your skin barrier, right? Try to really hydrate your skin. Make sure that you have not dry skin. If you have eczema, that's also an area where there's skin breakdown. You're letting the outside in. And then really try to sleep better, eat better, exercise better, get outside. Vitamin D is really important. And those are simple things that we all talk about, but are harder to do. I find it challenging to do all of those things too. But that's how we can start to restore our immune system in small ways.
Aside from restoring our immune system, you had touched upon it earlier about antihistamines.
Yes.
There are a lot of over-the-counter medications for allergies.
Yes.
How effective are they? And how do you know at what point you go and see your doctor because those OTC meds aren't working?
Yes. So I have many patients who come to me because, as we started off, the season is worse this time. This year, my allergies are really killing me. And that's a slow build over time, right? But over-the-counter medicines can be effective. Antihistamines, right, are really important. And they really try and block the effects of allergic inflammation from that regard. There's many different kinds of over-the-counter antihistamines. You don't need a prescription for that. There's generic and brand names. And what I tell patients is go to Costco and buy what's available and try that every day if you find that it's helpful. But then over time, like maybe later in the allergy season, it's not helpful, you can switch to a different antihistamine.
What about inhalers?
Inhalers, you need a prescription for. And that's when allergies really are bad to the point where they affect your lungs. And that to me is really important. I'm a pulmonologist. This is what I see all the time. I also see this at home in my own family. And that's scary because that means your environment is triggering trouble breathing. And asthma can be life-threatening. So it's really important to understand if that's a trigger for you, if for a trigger for your asthma, your environment, and really to minimize those triggers. So yes, you need to have a short-acting inhaler. That's your albuterol inhaler. Those come in different colors and different names. But when you have an asthma attack because of allergies, you should take antihistamines. You should use your inhaler. So those are kind of the pills and medicines in your pocket that you should always have on hand.
But at what point do you have to see the doctor? You've tried the medications, but you still have the watery eyes. You still have the sneezing, and they say, I just can't take it anymore. At what point do you see a doctor or get medical assistance?
At the point where it's really impacting your day. I mean, I think everybody should also be informed about what are the things in the environment that are causing these allergies, because allergists can do allergy shots. And so that's really the thing that will change the course of allergies is allergy shots. And that is taking the things that you're allergic to, putting it into a shot, and desensitizing your immune system to those pollens or pets that are causing the symptoms.
And just real quickly, in terms of the over-the-counter medications, is there a point where it doesn't become effective at all? Does it kind of lose its effectiveness?
Right. So sometimes people include decongestants because they're so swollen and have all of these side effects, which are miserable, and it's affecting your sleep, and you feel tired. This is also an important point. You know, you should go and see your doctor if you're having those types of systemic kind of symptoms. And if you use decongestants, yes, your body can become tolerant and you need a decongestant holiday. That's the pseudoephedrine that you have to go to behind the counter. You have to talk to the pharmacist. You have to give your driver's license and get that kind of allergy medication dispensed to you. You don't need a prescription, but it's a little bit more controlled.
We've been talking about seasonal allergies. What about the difference between a seasonal allergy and a food allergy?
Yep. So food allergies are also very serious and can have a very severe allergic reaction that could lead to death. Now, the instance or rates of deaths from food allergy are small. We're talking about 200 to 300 a year, but in my mind are preventable. And now there's new medications that can really help mitigate that risk.
In fact, you had a study published recently about food allergies and kids. I mean, this is what a parent worries about the most, food allergies with their kids and what they can't eat and what they can eat, especially when they're not there. Tell us about that study that you did.
Yeah, thank you. So, food allergies affect 2 kids in every classroom. When I was growing up, I didn't know anybody who had food allergies, and now my kids have a few friends with food allergies. So even if you don't have somebody with food allergies in your family, you probably have them in your larger circle. So we really wanted to understand, can we get at the root cause of food allergies? So similar to seasonal allergies, food allergies are caused by allergic antibodies, recognizing proteins in foods and causing allergic reactions. Except this can also lead to serious allergic reactions that affect your heart, your lungs. Anaphylaxis, exactly. So that's when you're eating a food that you're allergic to and the proteins are circulating all throughout your body, and you have cells that recognize those foods and cause allergic reactions to occur in all of your organs. And so the life-threatening ones are when we have lungs and heart involved.
And your study, I just want to interrupt you here just slightly. Your study involved a medication that these kids could take. It's not as though they're allergy-free, but this medication helped them a lot, especially with the sense of anxiety, not only on their part, but their parents' part as well.
Yes, this is huge. So the medication that you're talking about is commonly known as Xolair, omalizumab, and it's an anti-allergic antibody. So it's a biologic. So it's a drug that recognizes the allergic antibodies and really sponges it up, takes it out of circulation in an allergic person. And the study looked at almost 200 kids and gave this medication Xolair as an injection over 4 months, and then tested to see if these kids could change their threshold for the amount of food that they react to. And it did. So we were super excited because, we're taking allergic antibodies out of circulation. We think that this should work for food allergies and for other allergies. And we were really happy to see that in 2/3 of the people who got Xolair or omalizumab, they were then able to eat or ingest safely small amounts of the foods that they were allergic to.
I know I talked to a couple of parents, families involved in the study, and they said this was life-changing, that they could sort of be stress-free for a while in terms of monitoring what their kids ate. Wait, how do the parents, how the families go about getting this medication or getting a prescription?
Yeah. So this study and many studies that were done at Stanford and other academic centers across the country led to the approval of Xolair for food allergy patients. So that just happened in February. And by the end of February, we were writing prescriptions for our food allergy families. And you're exactly right. So the FDA has approved this to be used in conjunction with avoidance. It's an injection that's given to food allergic patients. And it is a game changer because there's a certain extra degree of freedom that you've got another blanket of protection when you're sending your child out to eat, and you're not carefully scrutinizing every single ingredient on our new snack or on the wrapper of a cookie or a homemade good, and worried that you're going to eat something that is forbidden.
You talked about a certain amount of avoidance, but how do you carefully introduce these foods to those kids with the allergies?
That is a different form of therapy. That's oral immunotherapy. And just like we can do desensitization with allergy shots, oral immunotherapy is done under medical supervision to introduce small amounts of the food into the diet.
Like small amounts of peanuts?
Small amounts of peanut, eggs, or milk, or egg. And, we make all these food flours in our center here. At Stanford, and we characterize each one of them. So I have a whole team in our manufacturing team that's really looking at how much peanut is in this little cup, how much milk is in this little cup. And we have a protocol where we do, one peanut seems very little, but we start off with 1/10 or 1/20 of a peanut. So it's really like a peanut crumb that you would find in a pad thai dish.
Well, we have to sort of warn people here. It's not something that you can necessarily do at home on your own. You need expertise, medical expertise.
Yes. Oftentimes here at Stanford, it's done under research clinical trial. There are other practices that are doing this, but it is in an allergist's office because with desensitization, you also have the possibility of creating an allergic reaction to that food. So, allergies can, most of our allergic patients are allergic to many things. right? Not just foods, but also environment. So there's a number of different factors that play into an allergic reaction. So during oral immunotherapy, you have to be under medical supervision to do this.
So oral immunotherapy, but also Xolair comes in the form of shots. How old do you need to be in order to receive these allergy shots, be it for a food allergy or another allergy?
Yeah. So Xolair is now approved down to the age of 1, which is so important because we're diagnosing food allergy in infants.
Yeah.
And so we're very excited that this is an early treatment option for patients to explore with their allergists. And you're right, it is a shot. And Xolair is now approved from 1 into adulthood for any food allergy, which is great. It's meant to be used with avoidance, so not in conjunction with oral immunotherapy. And each allergist, you know, I know shots are not easy, but we all have tricks to try and make it an easier therapy for patients.
And getting back to that oral immunotherapy, how do you give high-risk foods to babies, right? I mean, it starts as young, as you said, as when they're babies.
Yes. Yeah. So, you know, this has been a paradigm shift. It used to be that we said, avoid all of the foods, the top 9 foods in the U.S. Don't introduce this into the diet. And then we learned that that was actually creating more food allergies. So it's important to do early introduction of foods into the diet in babies.
Were you talking about like 6 months old? Or?
Yep, 4 to 6 months
Wow.
to introduce peanut into the diet. You know, and if a family has a history of another food allergy or that baby has eczema, a different allergic condition that can start even, you know, in the first days of life, then they may want to see an allergist about how they introduce these foods into the diet. But so that's part of the prevention piece. How do we prevent the growing numbers of food allergies? Is we need to introduce it into the diet early. And in that, we're still seeing that we're diagnosing food allergy early as 6 months when they're doing that first introduction. So there's a lot of studies underway of how do we treat babies with food allergy. And oral immunotherapy is one way. There's other forms of immunotherapy. So through the skin, actually with a patch, that's also under study. None of these are FDA approved yet. The only FDA approved therapy for 1-year-olds is Xolair or omalizumab.
In terms of, you know, treating babies as young as 4 to 6 months old, it comes to mind, and some of these questions are coming from our viewers. Can allergies be genetic?
That's a really great question. So the rise of allergies suggests that it's not just genetics, because if it were just genetics, it would take a longer time to manifest. We're seeing a sharper rise in food allergies and allergies. And so I think this is really the interplay of genetics and the environment. So the environment can influence the way our genes are expressed, and that can lead to the expression of allergic genes so that we're creating allergic antibodies. And that, again, is based on how clean we are, how are we introducing things into the diet, right? The gut is lined with immune cells. And so it's really important to introduce foods through the gut to promote tolerance and skew us away from allergies. And when we don't do that early enough, we're actually introducing food proteins through the skin. And again, we come back to this leaky barrier, right? This leaky skin barrier, and that can actually skew us towards allergies. So this is it's a combination of how our own exposure practices and environment and how that's changing with climate change, and how that influences the expression of our genes. Even
with climate change, and you take those preventative measures, can you outgrow an allergy? Is there hope? or light at the end of the tunnel?
Yes. So for food allergies, we often talk about foods that there's different groupings of foods. So food allergies can develop early in life. Milk and egg are two food allergies that are unique. They're a little bit different. You have a higher chance of potentially growing out of a milk or an egg allergy. Mm-hmm. That's great news. So that's important to check in with your allergist to see when and if you've outgrown a food allergy. For environmental allergies, it's possible too. Mm-hmm. When I see asthmatic kids, what we see is that most of asthma in children is allergic based. It's less allergy based asthma as we develop it as adults, and as they grow and develop and their lungs grow, we see that they can outgrow their asthma. They can change different things in their environment that may help them outgrow their allergies. The real answer is that we need more studies to understand what we call natural tolerance, mm-hmm. this natural outgrowing of allergies. Mm-hmm. We don't know who will outgrow allergies, but now there are treatments to help, seasonal allergies, year-long allergies, and food allergies. So you don't have to wait to see if you're part of the lucky few who've outgrown them.
In the meantime, and this is a viewer question about EpiPens. How do they help, and how do they reverse anaphylaxis?
EpiPens are really important life-saving medication. So epinephrine auto-injector comes as an EpiPen or different brand names. And what it does is it stops an allergic reaction right away. So for our food allergy patients or patients who have allergy-triggered asthma, even mostly with foods, or stinging insects like bees. Yeah. We tell people to carry epinephrine auto-injectors. Mm-hmm. And what it does is it all of the leakiness that happens when an allergic reaction is happening, mm-hmm. It tightens up everything and just stops the allergic reaction. It's really important actually to have two auto-injectors because it can act really quickly within seconds, but it can also wear off.
Oh, okay.
And so
two instead of one.
Two instead of one. Also, if you've never used it because you're scared of needles, right? The first time you may not hold it in, medication may not get in. So you'll always have a second one on hand to be able to make sure that the medicine is going in.
Mm-hmm. So you have the EpiPen, you have over-the-counter medications. Some viewers are asking what about these homemade remedies, other remedies that don't involve meds, like honey, for instance, local honey?
Yeah, that's a great question. So I don't think honey is going to give you the full effect. The idea behind honey is that it's trapping pollens that are local to that environment. And so immunotherapy is based on feeding small amounts of those pollens to your immune system, mm-hmm. right? Honey, you eat it, right? And so it gets broken down in your digestive tract, and we're not sure how much of those pollens are then actually exposed to your immune system. Mm-hmm. The difference between allergy shots or sublingual immunotherapy, so like little drops underneath your tongue for seasonal allergies, is that you're just getting more of that pollen that you're allergic to in a controlled way, mm-hmm. So that it is shown to your immune system regularly to change the course from allergy.
I'm thinking, we're outside today in the elements. Yeah. And you would think that you would suffer more from allergies with the pollen in the air, yes. during the day. But I've also heard that people suffer from allergies a lot at night. Why is that so?
That's a great question. So it depends. You're in more contact with at night, right? So dust mite allergies. Dust mites are mites that feed off our dead skin. And they live in areas where you spend a lot of time. So in your bed, especially if you have a lot of stuffed animals.
Mm-hmm.
And so,
and if you have pets too, right? Dog hair,
cat hair. So if you have animals that you're allergic to and they spend time in your bedroom, so when you're dander and allergens, and that can really impact the way you feel at night. So there's all different types of things you can do to lessen your exposure. There's indoor air purifiers, there's dust mite covers. And it might be that you're outside all day and you're allergic to tree pollens, right? And so when
take a nice hot shower.
Exactly. You got it, Lisa. It's like wash all of those allergens away so that it's not in your hair. It's not in your clothes. You're not sleeping on it, breathing it in, getting it in through your eyes, through your skin, and really kind of removing the exposure.
Do air filters help?
Air filters can help, yes. Particularly for people with pet allergies or dust mite allergies, kind of indoor allergens that really can lessen your exposure to them.
And then for over-the-counter drugs, some of them you take regularly, and you have drowsy, and you have non-drowsy. Why do they make you sleepy in the first place? I mean, that's dangerous when you're driving or doing, manual activities.
Yes, you're absolutely right. So Benadryl is that short-acting antihistamine that people use when they're having allergic symptoms, but it makes you sleepy. And it's because it's crossing into your brain and affecting histamine receptors in your brain. So that's something that I say take at night. But the non-Benadryls, like the Claritin, the Zyrtec, the Allegra, the generics of those medications. You
can pop those first thing in the morning?
You can. And there's, for people who can't swallow pills, I know my children have a hard time. There's even the ones that dissolve on your tongue, or liquid. And so it comes in different forms for however you can take it.
You've given a lot of great advice today, but I want you to leave here giving our viewers some key messages in terms of what to look out for, how to take care of yourself, and that there's light at the end of the tunnel, basically.
Yeah, I think we have really learned a lot, over the last decades about how to manage symptoms, what causes are leading to the increase in allergies. And a lot of it is how we take care of ourselves, like you said. So really, you want to make sure that you're doing the best that you can. Eat a diet with fruits and vegetables in it.
Moisturize.
Eat a diverse diet, really, because that's promoting healthy gut bacteria. That plays a role in the way we see things from our environment, and really skews us away from allergies. Other researchers at Stanford here have looked at fermented and fibers, right? So those are all really important, diverse diets. Take care of your skin. Take care of your immune system, and sleep is an important part of having a healthy immune system. Easier done. Easier said than done. Yes.
I'm guilty.
Yes, me too. And make sure that you get outside, that you're laughing every day. Right? Those are all really releasing good endorphins and really stimulating your immune system in a good way.
Before we stop, on the diets, we've heard so much about diets, intermittent diets, keto diets, fasting, so on and so forth. Does that play into allergies as well if you're avoiding certain types of foods that are supposed to be good for your gut or your microbiome?
Yeah. That's, really an important point. And I think those types of diets really change the way our metabolism works.
Yeah.
And we haven't really gone into how our metabolic health affects our immune system. They're definitely connected. And, I think a lot of this is really trying to tamp down on obesity rates in the U.S., right? And we know that there's immune system in our fat cells, right? So all of this is interconnected. How it plays a role to skew us towards allergy and away from allergy still needs further investigation. But this again goes back to the basic principles of having a healthy lifestyle, right? You need to move and have diverse foods that get you to a healthy set point.
So eat right, sleep right, moisturize,
Yes.
and enjoy life.
Yes.
And
You got it.
It's okay to be outdoors amongst all the pollen, right?
It is. But if you're an allergy sufferer, you can make some smart decisions about that, about the timing of your exposures outside. And so,
Any recommendations on that?
After a rain, it looks kind of cloudy today.
Yeah.
The rain takes the pollen out of the air. And so that's a good time to be outside.
Even though we enjoy the sunny skies, a little rain doesn't help.
Yes.
Does help.
Does help. Exactly. And then, if you're outside, which you should be, just to make sure that you can clean up and try and take the outside off, changing your clothes when you come inside, washing up, and that can really
Evening showers.
Evening showers. Exactly. Yeah.
Great advice. Sharon Chinthrajah, allergist here at Stanford Healthcare and Stanford Medicine, director of the Allergy and Asthma Research Center here at Stanford as well. Thank you so much for joining us today. This has been a great Ask Me Anything about allergies. I'm Lisa Kim. Again, this is Sharon Chinthrajah. Be outdoors, take care of your skin, eat right, sleep right, and you'll be fine. Thank you for joining us.
Thank you, Lisa. Thank you.